Okay, hi, I'm Leann Forst with leannforst.com, and today I'm here with Dr. Jeannette Mucciolo, and we are going to talk about essential oils with chiropractic care. So, welcome, Dr. J. How are you today?
Hello, doing good. Doing good. Thanks for
So
having me.
glad to, yeah, I'm so glad to have you. So, welcome. So, I'm excited to talk to you because what I'm trying to do is put together a series of videos to help educate people on all the different ways to use essential oils. And with you being in business and doing chiropractic care for what, almost 24 years,
Yes.
right? So you've been using oils for a while. So I do want to get started with just saying your bio so that people know a little bit more about you. Um, Dr. J is a chiropractor that has been practicing in Nashville, Tennessee for almost 24 years, specializing in gentle chiropractic. And she's also a business leader with doTERRA, providing natural solutions such as essential oils to her clients to help support better health and healing. Her mission is to educate and empower people to live their healthiest life while becoming the healer in their home. I love that. Become the healer in your home, because we really do need to be the health coaches for our families, right?
Absolutely. Absolutely.
So, yeah, I just wanted to start out by talking about, what got you into chiropractic care, and then what got you into oils, using essential oils in chiropractic care.
So, what got me into chiropractic care is actually, I was standing around in a room in my classroom when I was in seventh grade with a bunch of 12-year-olds, and we were all talking about what we wanted to do. And somebody said, I want to be a chiropractor when I grow up. And I said, that sounds good. That's what I'm going to do. And way more than 24 years later,
And
here I am.
you knew when you were 12? That's just astonishing.
It was like a light just went off and it was like, yes, that's it. I think it had to have been a God thing saying, yes, this is your path, take it, because I got nothing but encouragement from my parents, my family, my mentors, everyone. And then I even had people fall into my lap as far as like a chiropractor who mentored me, and a psychologist who I worked as a personal assistant for, who really helped me lay the groundwork for being a great boss, as well as um, just really encouraging me to take my path and to go for it, become a doctor, and really got encouraged all the way through it.
Oh, that's awesome. I think when I was 12, I wanted to be an oceanographer.
Awesome.
And that wasn't very practical, considering I was living in Iowa. So I did not get encouragement for that one. So then, going through your journey, chiropractic, first of all, what's gentle chiropractic care as opposed to what other chiropractors do? What is that?
Um,
What do you
I
specialize in?
tell, I tell people I take the crack out of chiropractic. I do not use the hands-on cracking, crunching, rotational moves. I instead use a spring-loaded instrument. The patient is mostly, for the most part, face down for the adjustment in a neutral position, and I do the adjustment with a spring-loaded instrument. It delivers the adjustment through force instead of through speed. So it's just very gentle. It sounds a little bit like a staple gun, but it feels a whole lot nicer. It's safe to use on newborns. I've treated babies just hours old, and I've treated elderly in their 90s. So
Oh,
it
wow.
works for everyone.
That's awesome. I wish you lived in Dallas, because I feel like sometimes I've gone to a chiropractic treatment and I've come out in more pain than what I went in.
And that's
So,
why people come to me, is they're looking for that gentleness, that where they can typically feel much better and much relief instead of feeling like they just got beat up by their doctor. So
yeah,
some
that's good.
people love the crack, and it's not for everybody.
Hmm. Okay, that's good. So then, besides doing chiropractic treatment on people, I know that you are really into essential oils and how they could benefit the whole person. Talk a little bit about that and how you use them in your practice to help people that come to you for their different ailments.
Well, typically people come to me for musculoskeletal issues, um, whether it's headaches, whether it's back pain, neck pain, carpal tunnel, things like that. So a lot of times I'm addressing the soft tissue or the joints. So I may use Deep Blue partnered with lemongrass. Deep Blue is a soothing blend that really helps with uh, soothing the muscles, soothing the joints, giving relief for the patient. I will often use it for different types of patients, whether it's a patient that's that I've diagnosed with arthritis, or if it's a patient that might have just been working out and is sore from their workouts, overdone, done it in the yard, anything like that. So those two are my go-tos. I love frankincense because frankincense is an oil that crosses the blood-brain barrier, so it's going to really affect the central nervous system in a positive way, and that is one of my go-tos as a chiropractor, to affect the central nervous system, to really get to the spinal cord and really help healing. I will typically dive deeper once patients get out of their pain. I do encourage them to, let them know, first of all, that chiropractic is definitely for musculoskeletal system, but because we're dealing with the spine, the spine goes everywhere. It goes to every cell in the body. It goes to the brain itself. It goes to the organs. It goes to the little toe. So we want to make sure that all of those areas are flowing properly by opening those pathways, but then also encouraging that with the oils to support the system. What I end up often doing is digging deeper where they may have other issues. Every patient that comes into my office gets a very thorough exam. They fill out a confidential patient intake form that lists all of their ailments, whether it's respiratory, digestive, reproductive, you name it. And I will go ahead and first deal with their chief complaint, and then also dig deeper and see if we can help them with some of their other issues. What I love about the oils is that instead of just being able to adjust that vertebrae that goes to that area of concern, whether it be the respiratory, the digestive, reproductive systems, I now have more tools in my tool belt and can use the oils to support their systems as well. So a lot of times I dig a lot deeper with what is going on, whether it be gut health or you name it, and we just go ahead and look at the overall body. And talking about being a healer in your own home, I am very much someone who wants to get people on a path where, like, my ideal patient is somebody who comes in every 6 months feeling good. I want to make sure that they're doing what they can on their own. I don't want to see them 3 times a week for the rest of their life. I want them active, proactive in their care, and really targeting what their goals are and working toward those goals with whether it be supplements, oils, exercise, rest, decreasing toxicity in their life, all of it.
That's great. I love that because with what I do being a health coach, it's really about addressing the whole body. And so you're not just going to pop them back into place and send them on their way. You're going to look deeper, and because the body, I try to explain this to people, and I see a light bulb going off when I say, the body is all connected. Nothing's compartmentalized. Just because you have something going on here doesn't mean it's isolated. It's usually connected to something else. And knowing that the spine does affect every cell, every organ, everything, it's all connected, right? So when you use a total lifestyle, a total whole body approach, you can have total body healing. So I've learned that as well with my own family and my husband. And essential oils are big in my family as well, knowing that my husband's a brain cancer survivor. So I know that we have one thing in common. In fact, is the symphony of the cells. I use that in my family. I've used it on my husband. It's a protocol with different essential oils. Can you explain like when you use that, or how you use that, or what protocol you use with some of your clients, or how do you uncover that that's a necessary protocol?
Well, Symphony of the Cells is basically layering several different essential oils. There's actually several oils they're using in each protocol. And when using those oils in a particular order, it targets certain systems of the body to stimulate the system. And I went ahead and went through a training for that and have really enjoyed implementing it into my office. My massage therapist has also been through a couple of those trainings, actually. She went back for more. And she does the protocols more often in the office than I do, just because of time. And it's really amazing what it does, because it really stimulates the body to detoxify as well as heal, and it jump starts the system. And doing it several times, we typically recommend, or Boyd Truman, who started it, recommends doing most of these protocols 3 times a week for several weeks ongoing to really help stimulate the systems of the body that you're targeting to work the way that it's supposed to. And I use the lymphatic protocol in my office quite a bit. I use the inflammatory protocol. We also use the infectious protocol because so many different systems stem from that. The fertility, or sorry, hormonal hormonal protocol for fertility is very popular, and I do a lot with pregnant women, so that's a really good one to do. There's so many different protocols, the digestive, you name it. So there's a lot to do. It's hard to say which one, but I would say the two most would be lymphatic and inflammatory here in my office.
Oh, that's great. Yeah. So I use, our go-to protocols, especially for my husband or for is the cellular health protocol and then the Maxim protocol. And just for the viewer's sake, there's a book that comes with the Symphony of the Cells training, and it has all different protocols depending on what your health goal or health issue is. And essentially what it is layering the essential oils on the spine. The person's laying down and another person is putting the essential oils on the spine in a circular fashion all the way up the spine, and in a specific order. And so it has scientific research behind it that it affects certain systems of the body in a positive way, right? Because we know that essential oils, when applied to the skin and then to the spine, they can affect every cell in your body within 20 minutes. So yeah, it's been a very powerful protocol, and I hope that more people learn about it. So, and then with pregnancies, I mean, I think that's great with that you're doing your help. Like that's a big area for you, right? Is pregnancy, and what do you do there for? Is it like during delivery or?
I treat women throughout their entire pregnancy. And of course, I've actually worked on the fertility side of it too, helping women get pregnant. And it's always funny when somebody comes in and say, Dr. J, you got me pregnant. I'm like, it's a good thing I'm a woman. Sound a lot worse if that was a male doctor. So it's fun to see the changes in people's lives that can make. And I do a protocol with regular chiropractic treatments throughout pregnancy because of, number one, the most important thing is the relaxin hormone does so much to loosen the ligaments to prepare the body for delivery, but the side effect of that is that women go out of alignment very easily, especially as their belly grows and their center of gravity changes and the curvature is strained in their lower back. Right at that apex of their curvature is L3, and L3 is the one that supplies the uterus and the bladder. So, among other things, but with it being so stressed right there at L3 and so much stress on the uterus and on the bladder during pregnancy, it's really helpful to be able to get that and keep it in line. It helps women during the laboring process. If their spine and their pelvis, especially their sacrum, is in line, then it helps them have a more successful delivery. So I've worked with women with turning babies. That's been super fun. We've been pretty successful getting the babies to turn and stay in the proper position. So that's once I learned to do it, I think I've got 100% success rate with that. So I'm very excited about that. I even helped a midwife who her first baby was a C-section because she was transverse, a breech. And I was able to help her have a VBAC, and her baby turned 3 times, and every time we got her to, the second baby, got the baby to turn head down, and then finally got her to stay head down in time to deliver a vaginal birth. So that was amazing. And during all of that, like at the time, like getting closer when we're in the safety zone, week 37 to 40, 41, depending on how long they go. We do a lot with using acupuncture points. So I may adjust into the acupuncture point, the meridian point, with my activator to the spring-loaded instrument just stimulates that area. I'll show women how they can stimulate it on themselves by just targeting that meridian point to stimulate the birthing process or stimulate the point for turning the baby. We also work with using oils on those spots on the meridian points because that can be really effective. And then even there are some oils that can help with the natural induction. So we encourage at the proper time to be able to do that. And if their body is ready, it'll work. If their body's not ready, it's just going to be
Mhm.
supporting the system, but not necessarily stimulating the delivery process.
You are like a jack of all trades. When somebody thinks of a chiropractor, they just think you go in for a quick adjustment and you're done. But really, what I've heard from you is that you can help people with the pain, but you're also helping, pregnancy, delivery, hormone balance, migraines. It could be digestion. I mean, longevity, long-term
Absolutely.
health. I mean, is there anything, what else, is there anything else that I haven't mentioned that you uncovered during the, process with people that you've come across a lot?
Um,
Or have I pretty much covered everything? Because it
I
sounds
feel
like you're
like
kind of a
we've
jack of
covered,
all trades.
I feel like we've covered most, and I don't think of myself as a jack of all trades. It's funny you say that. I've always felt like I, narrow everything down to my specialty.
Mhm.
Um, but I don't do the quick
Yeah,
adjustment. I have a 20-minute visit for just a regular office visit is 20 minutes. So I do spend quite a bit
yeah.
of time with patients. And I know that not all chiropractors do that. A lot of them are just the quick uh, manual manipulation and send them on
Mhm.
their way. And I really want to target overall health. So, I mean,
Mhm.
for me, it's about the spine being the key to the entire body and making
Yeah.
sure that it's functioning properly so that the rest of the body can function
Yeah,
properly.
that's a better way of saying it so that people realize that the spine and being connected to everything, just taking care of your spine can take care of a lot of things. And then also with essential oils, incorporating that and how many hundreds of uses they have. And so really you can help more people with what they're dealing with. I love that.
And when
This
you
is
think
re-
about it, if it's your teeth, you can replace your teeth. For your spine, you can't really replace your spine. So it's like you've got to take care of it and make it a priority. And that's why I say, even a checkup every 6 months if patients are doing great, like that's the ideal time frame, kind of like a dental checkup where you go in, you make sure you don't have any cavities. Same thing with a spinal checkup. Go in, make sure that your bones are in line. If everything's aligned and properly functioning, the normal structure in the joint, then basically what's going to happen is everything's going to keep moving. If everything keeps moving, it stays hydrated. If everything stays hydrated, it stays young and um, supported. So
yeah.
otherwise, the degenerative processes come in when there's lack of movement and when bones are stuck out of place and it's not moving properly. That's when the downward spiral occurs. So people don't always know that they have those. That's why it's important to get get checked and make sure that things are moving properly.
Well, this has been great. Thank you so much for joining me today. And for those people that want to reach out to you, how would they find you?
I have a Facebook page. I am Back to Health Nashville. I am not very much on social media. I do not have a web page, never have with my um, with my 23, almost 24 years of practice. I keep things really simple in my office because I like being as calm and stress-free as possible. So I do have a page linked at activator.com. You can search Dr. Jeannette Mucciolo or search Nashville doctors, and you'll see me pop up. I'm one of just a couple in Nashville, and that's ACTIVATOR, activator.com. So that
Okay.
explains the technique. If you're looking for one in Dallas, you can go there and search for an activator doctor near
I
you.
think I'm going to do that for sure. I
So
appreciate it. And for my listeners, I'll go ahead and put a link to how to reach you below this video on my YouTube channel. And if any of you out there feel that there's somebody that that could benefit from this information, please feel free to share. And just by the way, I have a free ebook. You can click on the link below this video to get. And thanks for listening today.
awesome.